अथ पाण्डुरोगप्रतिषेधं व्याख्यास्यामः यतोऽथ भवन्तः. Panduroga is another of the controversial issue. In general, panduroga is translated as anemia, but actually if you go into the details, it's much broader than anemia. Any disease related to formation of the blood at any stage could be considered as a pandu. We'll go to that as we go into the detail further. व्यवायम अम्लं लवणानि मद्यं मृदं दिवास्वप्नम् अतीव तीक्ष्णं निषेवमाणस्य विदुष्य रक्तं कुर्वन्ति दोषाः त्वचि पाण्डुभावम्. The Pandubhava is a pallor seen on the surface of the body. It is one of the important signs, but not the only sign there, but it's one of the important signs of the Panduroga, or I would say discoloration of the skin is one of the issues. It's not necessarily that it should be white or pale. It could be even other discolorations which could be produced due to the pandu. And the causes were that is considered as a sexual activity, overactivity, sexual overactivity, and food which is not nourishing, amla lavana, that's non-nourishing food substances, or alcoholic preparations, or those who have a this habit of consuming soil as such, would be, or any other chikshnaha, any other pungent food could be caused for the rakta drushti, and then that results in pandu. Pandvamayo ashtardha vilah pradishtaha pradrak samastaihi yugapatya doshaihi. It's 4 types of pandu are described, and they are vataja, pittaja, kaphaja and tridoshaja. Sarveshu cha eteshu pandubhavaha yato adhikaha atah khalu pandurogah. Because the most prominent symptom is the pandubhava, that's a pallor, but at the same time there would be the discoloration of the skin, else otherwise also could be considered as a pandu. Because of the prominence and the most common presentation, it's named as a pandu. Tokspotanam sthibanagatasado mridbhakshanam prekshanam kutashotah vinmutra pitatvam adha avipako bhavishyatastasya purasrani. The predominant or prodromal signs of the pandu would be tokspotanam, roughness of the skin and maybe cracks of the skin, and a tendency to split as such, pain throughout the body, a urge for soil, eating soil, or abnormal likes for the food, altered likes for the food. Prekshana kuta chotaha, prominence of the facial bone area, temporal bone area, cheeks becoming quite prominent as such, or discoloration of fecal material, urine as such, either yellowish or discoloration, improper digestion are the pura rupa of the pandu. Sa kamala panaki pandurogah kumbhakpayo lagharako atilasakhyah vibhashyate lakshanam krishnam nibodha vukshami anupurushastada. Kamala, Panaki Roga, Pandu, Kumbha Kamala, Lagharaka, Alasa. These are all similar disorders which have similar symptoms, and their clinical features are described in due course of time. Now, as I said, the production of the blood has, the formation of the blood has many situations or many steps there. For making it brief as such, I would say the first of the is the heme synthesis. The one of the major part of the blood is the RBC, and hemoglobin is one of the major substance which gives color to the blood. So when it becomes pandu, it may be related to the same issue. And if the patient has an abnormality of the synthesis of the heme, that's the heme synthesis abnormality, which I would consider as porphyria, or the most common example would be the porphyria of that sort, where the porphyrin, one of the enzymes required for the formation of the heme, is not functioning properly, and there will be a formation of the abnormal heme, which results in the clinical manifestations. And the symptoms of porphyria, I will be dealing with that when we discuss the Vataja Vyadhis. Then you have the hemoglobinopathies, where there is an abnormal formation of the hemoglobin, and hence the hemoglobin tends to get destroyed rapidly, which results in the hemolysis. So abnormal hemoglobin results in formation of the hemoglobin is formed by 4 bonds between heme and globin molecule, and these bonds could be 2 alpha to beta normally. If there is alteration, instead of 2 alpha to beta, the sequence changes, then it produces the thalassemia like conditions or the other abnormalities which resemble that condition. Sickle cell anemia also can be of the same sort. In such conditions, RBCs tend to get destroyed as such. Now, when a patient presents with the clinical symptoms of anemia, because we consider anemia as one of the issues, one of the most important investigation which is done is on the hemogram. The interpretation of the hemogram is one of the critical issue in understanding these pathologies, these variations of the pathologies. They are, of course, the other abnormality which can produce that abnormality in the formation of the course of the formation of the blood is the bone marrow abnormality. Bone marrow, when it is not able to synthesize, which we call as aplastic or hypostatic abnormalities, bone marrow is not able to synthesize the RBCs, there again it could be, or the other way could be RBCs are lost, either as in case of bleeding, or hemolysis is where the RBCs are destroyed within the body. Now, when we go for the hemogram, the findings or the results which you get are, one is your hemoglobin concentration is lesser, and when we say anemia, the general definition, universal definition is when the hemoglobin is less than 11 gram %, it is considered as anemia. But practically in our situation, even less than 10 grams has to be considered. We will have to modify this. The issue is the normal level of hemoglobin, which is mentioned as 14 plus in the males, is not generally seen in majority of the patients. If you look at the people population here, the majority of the people would not have 14, it will be something around 12, 11, which is the average. And often it is considered that a level of hemoglobin more than 14 or at high level is considered as a sign of health. But practically, this fact has to be seen in the different view. Now, those persons who are living in the urban area, they have a comparatively higher hemoglobin level, whereas those who are living in the rural area, compared to the average hemoglobin level is lesser. So there is a general notion that the village people have anemia, but practically this real situation is something different. In urban area, the air is polluted, the amount of the oxygen available in the air is lesser, and to facilitate, to cope up with that oxygen deficiency, the nature makes the body to have more hemoglobin. So hemoglobin concentration in such people would be more. Whereas those who live in a healthy environment where the oxygen concentration is better, you do not require that much of the hemoglobin, and hence that criteria of 11 grams has to be seen with a pinch of salt. Many of the persons who are otherwise healthy may have a level which is around 11 or maybe even slightly less than 11 occasionally. But a hemoglobin level of 12 or 13 need not be considered as something like a deficiency, though we consider that 14.6 as a normal. And those who have 14.6 or above that level in urban situation may not still be healthy, they may have the problems like. So in such conditions, to have a proper assessment, you go for the hemogram investigation. The hemogram investigation, the most important facts which you get, or more important data you get, would be the mean corpuscular volume of the RBCs as such. And when the mean corpuscular volume is less as such, less than normal, in 20% less than normal, then you will have to go for the red cell count, and if the red cell count is around 50,000, then you will have to go for the further investigations which will be suggesting of hemoglobinopathies, abnormalities of the hemoglobin like thalassemia and so on, where it could be resulting in breakdown of RBCs. If the count is normal or slightly higher than normal, then you consider this as abnormalities of the iron deficiency, and in that condition the next level of the investigation would be serum ferritin has to be studied, which suggests about the deficiency, which can confirm about the iron deficiency, and hence iron deficiency anemia could be made out. Suppose the mean corpuscular volume is in between 95 to 91 as such, in 80 to 95 as such, and corpuscular hemoglobin level is lesser, 27. Then if it is lesser, then it could be again iron deficiency where serum ferritin has to be studied. Suppose if it is not there, if the hemoglobin concentration is normal, then you have to go for the study of the morphology of the RBCs, and if the morphology of the RBCs shows abnormality, like the shapes of the RBCs are abnormal, which may consider the membrane abnormalities, and if there is such membrane abnormalities, you consider membrane disorders like sickle cell anemia, thalassemia and so on. Suppose if it is not there, then again you have to repeat the serum ferritin as well as homocysteine abnormalities. Serum ferritin, if it is lesser or less than normal, then it could be a mixed deficiency where there could be iron deficiency as well as there could be vitamin deficiencies. If the serum ferritin is normal, and then it could be produced due to the other causes where there could be due to some liver pathology, thyroid stimulus or such systemic causes which can affect the formation of the RBCs. Suppose mean corpuscular volume is in between 96 as such, less than 96 as such, then you will have to go for the peripheral studies where the shape of the RBC have to be studied. If the shape of the RBCs are oval, then it could be produced due to or abnormalities of the growth of the RBCs. So you will have to go for homocysteine studies, and if the homocysteine study is showing a lesser level, then it could be you will have to also study the folate study, which could be suggesting about the folic acid deficiency, folate deficiency. Or if the homocysteine level is normal, then you will have to go for serum B12 studies, and then you diagnose this as a B12 deficiency. If the shape is round per normal, and then it could be produced due to other causes, systemic causes as such. That's how it has to be assessed. So mean corpuscular volume and mean corpuscular hemoglobin concentration, MCV and MCHC, are the important criteria. The other investigation factors which you get in other facts which you get are when you go for a hemogram as such, you get the count of WBC, and if the WBC level is abnormal, it could be either produced due to infection where the level is raised. If the level is reduced, it could be again due to some infection, or at times it could be bone marrow pathologies, systemic conditions, impaired immune conditions could be the cause for reduction. If the hemoglobin level, next is the hemoglobin level as such, if it is increased or the total RBCs are this hemoglobin level is increased, it could be polycythemia. If it is reduced, it is called as anemia, which is the major interest as such. Then if the platelets are normal or the platelets are above normal, then it could be the polycythemia. If the platelet count is lesser, it could be the purpura, different varieties of the purpura, or the diseases like dengue where the platelets could be destroyed. Mean corpuscular volume 80 to 100 per the normal liter, and that's what we have already discussed. If it is raised, it could be folate deficiency, reduced iron deficiency usually. Corpuscular hemoglobin, if it is raised, it could be due to macrocytosis or is being bigger, and if it is lesser, it's again iron deficiency anemia. Mean corpuscular hemoglobin concentration again, it is raised in case of hemolytic anemia, spherocytosis as such. It is reduced in iron deficiency anemia. Then platelet volume, mean platelet volume is increased in bone production or these purpura-like conditions, whereas the bone marrow suppression, the count is volume is reduced. Neutrophil count is again is increased in infection. It reduced in certain infections like typhoid infections as such. Lymphocyte count, it is increased in case of viral infections, some bacterial infections. It reduced or it could be in leukemia-like conditions, and it could be reduced in idiopathic in immune compromised conditions like HIV, AIDS, etc. Monocyte count, it is again infection, it's increased in case of the infections like viral fever or bacterial fever. Could be reduced in patients of leukemia, steroid use, aplastic conditions. So eosinophil count, it's increased in case of infections with the fungal origin or hypersensitivity reaction. Reduced in case of sepsis or patients with the COPD as such. And basophil count also is increased in infection, reduced in case of malignancy or severe injuries. The morphology of the RBCs also is one of the important factors which will give you some idea about the different varieties of the abnormalities of the blood. As I said earlier, the normal RBC would be around 5 to 6 mu in diameter, micrograms in millimeters in micrometers in diameter, and it will be concave disc shaped structure with the more density of color in the center and the comparatively paler in the middle. Microcytosis size will be reduced usually in iron deficiency. Macrocytes are usually seen in vitamin B12 deficiency. All macrocytes also are seen in folate deficiencies. Hypochromic is iron deficiency anemia often. Similarly, the color density, hypochromic, the color of the RBCs, hemoglobin, gives that concentration, which could be either iron deficiency or any abnormalities of the formation of the hemoglobin. Then polychromasia, where the color could be more, it could be often seen in polychromatic disorders like. Then the shape variations, it could be like target cells, which could be in case of the splenectomy conditions, or it could be spherocytes, where the shape would be global, or ovalocytes, or stomatocytes, which are the genetic abnormalities which make the RBCs fragile. And they are sickle cell also is a same category, where the hemoglobin perkis, abnormalities of the hemoglobin would be there, which result in these conditions. Acanthocytes are often seen in case of infective pathologies. Helmet cells also are seen in case of any hemolytic anemia. Schistocytes are due to infection with the malaria. Teardrops also are seen in post-splenectomy conditions. Blood cells also are produced through infective conditions. Then inclusion bodies, where there could be abnormal substances deposited due to metabolic pathologies, could be seen in case of the RBC shape as such. And the agglutination of the platelets or rollets formation, where the RBC cells tend to get merged, they suggest about abnormalities of the clotting phenomena. So that's how the interpretation is done clinically, which helps you to make out these varieties of the panduroga. Now, coming to the clinical signs, in case of the Vataja panduroga, the clinical appearance will be Krishnakshanam Krishna Siravanandam Tadvarna Vinmutra Nakhananja Vatena Pandum Manujam Vyavaseta Yuktam Tatha Anyehi Tadupatravesha. A Vataja panduroga patient would have blackish color, a blackish color seen in the eyes and throughout the body. He may seem to be having deposition of the blackish color, even in case of urine, feces, etc. And that's considered as Vataja Vyadhi. Now this is and that's exactly what I said earlier. Pandu doesn't mean only pallor. A variation of the color towards the blackish color also is a variety of Pandu, the Vataja Pandu. And this is exactly seen in case of porphyria. It's exactly the same. And the porphyria is defined as a group of syndromes, largely hereditary, that results from defects in porphyrin synthesis and heme synthesis. Clinical symptoms could be quite wide varying. It's a wide systemic disorder where we may have symptoms of the muscle weakness, neuropathic pain in the limbs as such, abnormality of the sensory pathologies, even fatigue can occur. Respiratory paralysis also can be one of the critical conditions in case of porphyric crisis. Skin symptoms are very characteristic. A diagnosis of porphyria is easier when you look at the skin lesions, which are seem to be these deposition, blackish depositions with the discolorations over the area. Skin tends to get cracked, exactly the clinical symptoms of Vataja Pandu. And the central nervous system symptoms also are common in such patients, which can present as anxiety, depression, or some behavioral abnormalities. Seizures also could occur. Insomnia is also characteristically seen. Autonomic symptoms also are commonly seen, like nausea, vomiting, even hypertension, tachycardia also can occur in such patients. Even there could be a tendency for hyponatremia, or even urine can become reddish. Porphyria is important because it even can present with acute abdominal symptoms occasionally, and very often it mimics that of appendicitis. And a wrong diagnosis of appendicitis and surgery, if at all done, it can result in serious complications. So in general, porphyria is can be categorized as neuropsychiatric or cutaneous, majority depending upon the clinical presentation, and even it could be classified based upon the clinical course like acute intermittent porphyria or amino nucleic acid dehydratase deficiency porphyria, or it could be porphyria cutaneous tarda, or these are only from the point of view of the clinical presentation and the types but I think if you keep that it's a complex disorder presenting with multiple symptoms, these finer names are not much important. A diagnosis of porphyria is good enough. Maybe from the point of view of predicting the prognosis or outcome, these may have some value as such. Anyway, that's about the Vataja Pandu. Pittaja Pandu is Pitakshanam Pita Silavanadam Tatvarana Tadvarna Vinmutra Nakhananja Pittena Pandum Manajam Vyasya Yuktam Tathanehi Tadupatravesha. Pittaja Pandu would have a yellowish discoloration of the body, which can result in the yellowish discoloration either in all the fecal material as such, which is very characteristic of the hemolysis. Hemolysis is the RBCs, when they are destroyed, it can present with the increased concentration of bilirubin in the body and this hemobilinogen, and it can result in the yellowish discoloration, or which we call as a jaundice. Hemolysis could be again considered as either vascular within the blood vessels itself, or extravascular. Intravascular are often produced due to fragility of the RBC shape being abnormal, or due to some chemical substances being attached to that, or some environment of the blood which can produce the destruction. Whereas the extravascular usually is due to some abnormality in the spleen or liver, and hence the RBCs get destroyed over there. Now, the common causes for the hemolysis are patients who have prosthetic cardiac valves. During every beat, the RBCs may get compressed between the walls, artificial walls, and it may get destroyed. But of course, these days the shape of the walls are altered in such a way that this doesn't occur. But older techniques of the prosthetic valves, they used to have these cardiac valves, heart valves could be producing this. Another common cause for the hemolytic anemia is G6PD deficiency, which is genetic. Then thrombocytopenic purpura also can result in hemolysis. Intravascular coagulation, DIC, also can result in the issues. One of the other common causes is incompatible blood transfusion or paroxysmal nocturnal hemoglobinuria, one of the genetic pathology where there could be abnormality. COVID-19, now one of the recent issue, which is again a well-known cause for the hemolysis. Abnormality of the pyruvate kinase also can present the hemolysis. So hemolytic anemia is usually presented with a jaundice level where the direct bilirubin level is increased, and that's exactly what you see in case of the Pittaja Pandu. Shuklakshanam Shukla Siravanadam Tadvarna Vinmutra Nakhananja Kafena Pandum Manujam Veset Yuktam Pratha Anehi Tadupatravesha Sarvatmadam Sarvamidam Veset. The Kafaja Pandu would be presenting with a pallor, typical pallor, and the pallor may be seen throughout the body. This is exactly what we see in case of the deficiency anemias. Now, so classical anemia, which we see often either due to deficiency of iron or other nutrients, it can present with the pallor, and this can occur due to multiple causes. It is not that every patient of anemia has a pathology related to the blood formation, that system of hemogenesis or hematopoiesis. There could be an abnormality otherwise too. Patients who have abnormalities of GIT, gastritis, ulcers, or patients who have liver or kidney disease, patients who have hypothyroidism, or patients who have hemolytic disorders like sickle cell disease, patients who have abnormality of the menstruation, hypermenorrhea, or history of anemia or blood transfusions, thrombocytopenia, cancer or other chronic illness, dietary abnormalities also can be a cause for the anemia. So a patient presenting with anemia, it's not that every patient has a abnormality related to the hemopoietic system. There could be the other conditions also, and that's why you need to go for all the detailed investigation and make out the cause. And of course, the most common variety of patients are iron deficiency anemia, where you may give iron supplement. Whereas the patients who have aplastic conditions, abnormal bone marrow, their iron supplement will not help. If the patient has systemic disorder like liver or kidney disease, iron supplement would not help. So that needs to be treated, and hence the pandu or the typical standard pandu is not a very simple case of anemia, and it's not that every patient has to be given iron regularly, which has become a norm now, but you have to evaluate and then identify the causes. And the such conditions, as I told you earlier, the morphology of the RBCs would be one of the important criteria. If it is a microcytic anemia and the color is lesser, it could be iron deficiency, thalassemia, or the sideroblastosis, lead poisoning could be the causes. Macrocytic, if the RBCs are bigger than normal, then it could be deficiency like vitamin B12 or folate, or liver disease or hypothyroidism. Normocytic, if the shapes are normal, again either it could be primary bone marrow disorder like bone marrow abnormalities related to the formation of the RBCs or bone marrow destruction produced due to radiation or some malignancy, etc. Secondary bone marrow disorders, where the bone marrow may become abnormally active, as in case of liver cirrhosis, uremia, inflammation, or endocrine conditions, also can present with a temporary bone marrow abnormality. So a patient presenting with a tendency to have aplastic or hypostatic, you need to identify whether it's a primary bone marrow disorder or not. A secondary bone marrow disorder doesn't require any specific treatment to the bone marrow pathology. It should be, you have to evaluate the cause for that, and that has to be treated like liver pathology, uremia, etc. Primary bone marrow may require the bone marrow transplantation like techniques as such. Anyway, that's about the issues related to the hemopoietic system or pandu. The next is kamala. Vakshami lingani atha kamalayaha. Kamala is a condition where there will be yellowish discoloration because the pitta pandu would be presenting with the similar symptoms. Sushruta has referred to the kamala in the same context. And many people consider kamala as essential upadrava of pandu. It may not be, but it's one of the related condition which can present with the presentation resembling that of the pandu. At times it could be a complication of the pandu also. Yehi amayante sahasa annam amlam adyata apachyani chatasya pittam karoti pandu modaram visheshatu purveitau tandrabalakshayacha. The usual causes for the kamala, according to Sushruta, is a patient who is recovering from any illness. If he consumes excess of food, and particularly sour food, that can result in abnormality of the pitta. So there is an abnormality of the digestive mechanisms of the body, which can present with the clinical symptoms resembling that of pandu as well as the kamala. Bhedastu tasyaha kalu kumbhasahpa shofo mahastutra parvabedaha. Kumbha kamala is and lagharaka are the two varieties of the kamala. In the kumbha kamala, where the patient would have more symptoms of yellowish discoloration as well as abnormalities of the joint. Whereas jwara angamarda brahmasarva tandra kshayanmito lagharako alasakshaha, lagharaka and alasa are the conditions which often present with the systemic illness like jwara, angamarda, etc. Usually seen in case of hepatic jaundice, whereas kumbha kamala is seen in obstructive jaundice. Now, jaundice as such is categorized into prehepatic, hepatic, and posthepatic or obstructive. Prehepatic are those conditions where there is a hemolysis and hence the accumulation of the biliverdin in the body, and where the biliverdin is produced beyond the capacity of the liver to metabolize. Whereas the obstructive hepatic is when the liver cells are being destroyed, as in case of the infective hepatitis. Lagharaka and arasaka are suggestive of the same. Whereas a shofa, where there will be a huge swelling of the liver becomes swollen, is the kumbha kamala, which is produced in obstructive pathology. When the flow of bile is affected, obstructed, which results in the stagnation and dilatation of the structures there, that's the kumbha kamala. So that clinical features are very clearly defined of obstructive and hepatic pathologies. Whereas halimaka is Pittaka Harirapitanilam, Halimkam Nama Uranjanaha. Halimaka is a very severe condition where the hemoglobin level will be very high and hence results in somewhat greenish tendency. So it's suggestive of a very high level which could be seen in both hepatic as well as the post-hepatic or obstructive pathologies as such. उपद्रवाः तेषु अरुचित पिपासा छर्दिः ज्वरो मूर्धर्जा अग्निसादः शोभस्त्रता कंठगतो अबलत्वं मूर्छाक्लमो हृदि अवपीडनं च. The complications of the Kamala are aruchi, dyspepsia, excess of thirst, vomiting, fever, headache or impaired digestion capacity, even there could be edema and even unconsciousness or even pain in the chest also. Cardiac complications also can occur. Now from the clinical point of view, as I said, the jaundice as such is categorized into three categories: pre-hepatic, hepatic and the post-hepatic. And when you see the clinical pictures of serum bilirubin level, in the pre-hepatic it is unconjugated, whereas in hepatic it is biphasic, post-hepatic it is mainly conjugated bilirubin, which is seen more. And the usual causes are pre-hepatic, where the bilirubin is produced in larger quantities like hemolysis or hematoma, etc. And decreased hepatic uptake, as in case of sepsis, also the same prehepatic jaundice can occur. Or conjugation may be abnormal in case of Gilbert syndrome or the other congenital syndromes occasionally, which can present in the prehepatic pathology. Gilbert syndrome is classical, where the level of hemoglobin is usually at the border level and doesn't go into very high level. Hepatic is as in case of infective pathologies as such. Then post-hepatic is due to dilatation of the vessels, where the dilatation of the vessel is confirmed, which could be due to biliary duct obstruction or intraductal obstruction. Biliary duct obstruction, as in case of malignancy, metastasis, etc. Intraductal obstructions like gallstones or strictures and so on. So that's how it has to be assessed. So now we assess the Kamala and diagnose Kumbha Kamala or the Ladharaka with the technological tools. Now coming to the principles of the treatment. साध्यं तु पाण्डवामेनं समीक्षा स्निग्धं घृतेन ऊर्ध्वम् अधश्च शुद्धं सम्पादयेत् क्षौद्रघृतप्रगाढैः हरितकीचूर्णितैः प्रयोगैः पिबेद्घृतं वा रजनीविपक्वं यत्नैः फलं तैलकमेव वापि विरेचनद्रव्यकृतं पिबेद् वा योगांश्चापि विरेचनिकान् घृतेन. In Pandu conditions, where otherwise the patient physical condition is healthy and where he can be considered as a sadhya vyati, you will have to give virechana, vamana and virechana have to be given, and you will have to also have give the ghrita yogas with the shaudra ghrita, haritaki and or rajani vipakva ghrita, curcuma ghrita has to be given, or tailoka ghrita. Also, any other virechana krita yogas can be suggested as a treatment in case of the Pandu. What's the first of the treatment is virechana and vamana. Mutre nikumba arthapalam vipachya pibed havikshnam kudavardhamakram khade gudam vapi abhaya vipakvam aragudadi kvatilam pibedva. Go mutra with the gugulu and or guda people, guda abhaya, haritaki guda could be the other which could be given. Ayo rajo vyosha vidanga churnam dishad haritram tefalanitam va sarpir madhubhyam vidhadita vapi shastra pradesha abhishatamsya yogana. The iron bhasma, ayo rajaha. Now in Sushruta as such you don't get the reference of the ayo bhasma or bhasma of the iron as such, but ayo rajaha, particles of the iron are given, and in the preparation of the yogas you will see that the iron is either heated and dipped in liquid or stored in kashayas. That's how the iron is used as such. So preparation of bhasma is not really mentioned in the samhitas at that period. Bhasma is later rasa yogas. And then haridrakshi phala could be given. And harecha doshan bahusho alpamatran swayedhi devsheshu anisruteshu. The most important part of the treatment is the shodhana in case of Kamala. Dhapyapalanam rasam vikshujam cha mantham pibet kshaudriyutam hitashi. The other suggested supplements in the treatment of him, this Pandu as well as Kamala are Dhateswarasa or Ikshujaswarasa, sugarcane juice. Ubhe Brihatyu Rajanim Shukakhyam Kakadanim Japi Kakamachim Adari Bimbim Sakalambu Pushpim Vivacha Sarpihi Vipachet Kashaya Tat Pandadam Hanti Upayujamanam Kshirenava Magadhika Yatagni. Another of the Ghrita Yoga where you can prepare that. Then Hitanti Esti Madhujam Kashayam Churnam Samamba Madhuna Abalishyata. Another of the Deha Yoga with the Madhu honey. Gomutra Yuktam Tripala Daranam Datva Ayasam Churnam Analpakalam Prabala Mukta Anjana Shankha Churnam Lishyatata Kanjana Gairikotham. Another of the yoga, Gomutra Yukta Yoga. Then Ajam Shakrasyat Kudava Pramanam Vidam Haridra Lavanotam Pritak Valamshan Samagrameta Churnam Hitashi Madhuna Abalishyata. The pieces of goat with the Haridra and Saindava. Mandura Loha Agni Bidanga Pathya Vyosham Shakaha Sarva Samanatapyaha Mutra Sukoyam Madhuna Abaleha Pandvamayam Hantya Chirena Ghoram. Another of Mandura Leha Yoga, Mandura and Loha, they are given. The important is that discretion, when the iron has to be given, when the other drugs have to be given, that discretion is an important issue. Bhivitaka Ayo Mala Nagaranam Churnam Tilanam Gudascha Mukhyaha Takranupano Vataka Praiktaha Kshinoti Ghoran Api Panduroga. Another of the yoga where Hari Vibhitaki Amala this Ayomala, that's the Mandura with the Shunti is given. Sauvarchalam Hingu Kirata Viktam Kalaya Matrani Sukham Punava Murva Haridra Amalake Chalisha Stitam Gavam Sapta Dinani Mutre Mulam Bala Chitrakayo Pibedva Pandva Mayoto Akshasamam Hitashi Sukham Punava Lavane Natudyam Hita Shigroha Balam Kshira Bujha Upayojyam Shigurfala with the other yogas like Savarchala Hingu etc. has to be given. Negrodhavardasya Pibed Kashayam Shitam Sita Kshaudritam Hitashi Shaladikam Cha Api Atha Sarakurnam Dhati Param Madhuna Abalishyata. One more of the yoga where Negrodhadigana can be used. Bidanga Mustati Fala Ajamoda Parushaka Vyosha Nitlahanyaha Churnani Kurtva Budasharkarecha Prithiva Sarpihi Madhuni Shubhecha Sambhara Metad Vipachet Nidhaya Sarodake Saravato Ganasya Jatam Chaleshyam Matiman Viditva Nidhapayet Mokshakaje Samudre Hantyesha Leha Mokshakaje Samudge Hantyesha Leha Kalpandurogam Sashotham Ugram Api Kamalabja. A severe panduroga with the generalized demand Kamala also can be treated with the Bidanga Yoga, which has to be prepared in the form of Videha. Sashakara Kamalinam Bhandi Hita Gavakshi Sabuda Chushunti, one more of the yoga as a different yogas which could be used in Pandu. Kale Ke Chap Gisam Vipakum Hitam Chitam Sab Rajani Vishtam Dhatum Nadijam Jatu Shairajamva Kumbhakpaye Mutra Isama Pibeka Shilajati yogas. Mutra Stitam Saindava Sampriktam Masam Pibekvapi Lohakitam. Lohakitta or Mandura is a you kept in Gomutra with the Saindava for 1 month and then taken. Dadva Akshakasti Malam Ayasam. Dadva Akshakasti Malam Ayasama Gomutra Nirvapitam Astavaran Bijurnya Lidham Madhuna Achirena Kumbhakpayam Pandugadam Nihanyata Sindhut Bhavamba Agnisamam Tikrutva Kshiptva Chamutre Sakradeva Taktam Lohanja Kittam Bhushasta Takta Nirvapyam Mutre Bhushastadeva Eki Kritam Godala Pistam Etade Ekabhyam Avapya Pached Ukhaya Yatha Nagahe Tatha Vishushkam Churni Kritam Peya Mudashvita Kutta Takrodanashi Vijayatarogam Panduntuka Deepayate Anaraja. Now, a technique of using the iron, loha or mandura is described in this text. Now, this shows the evolution of the technology of preparation of the medicines, particularly inorganic substances used in Ayurveda. Inorganic substances used in Ayurveda in Samhita Kala, there was no process, there was no such a step-by-step process like Shodhana and Marana. That concept of Shodhana and Marana came in the later period of Rasahasra evolution. And in the earlier period, these were combined together. And the technique used by Sushruta for Loha, making it bioassimilable would be, it has to be heated in Akshakasta, that's very strong burning, like Badara Vriksha is Akshakasta, and it has to be dipped in Gomutra once it is heated. Heated metal is dipped in, and till it becomes a fine powder, and then it has to be given with the Saindava Lavana and so on. Or it also can be used in the form of same Gomutra with the Gojala pistam. That's cow dung also can be mixed together, and then it has to be heated, burned, the cow dung, so that it becomes a bhasma. So technique of preparing the bhasma in that period, Samhita period, is different from the preparation of the bhasma which we study in Rasashastra later period. Anyway, that's one of the other issue. Draksha Guduchi Amalaki Rasesha Siddham Gurdam Lagharake Hitam. In the Lagharaka, that's the conditions like intrahepatic pathologies. Draksha Guduchi Amalaka Rasa is suggested. Gaudan, Aristan, Madhusharkarashtra, Mutrasavan, Ksharakatam, Sudeva, Snigdhan, Rasan, Amalaki, Hupetan, Kolanatan, Vapihi Jangalanam, Seveta, Shofa, Bhizam, Shayugan, Pandwa Mahi, Shaliyam, Shanityam. The Pathya is the Arista, Madhu Shakara, Mutra Asava, which can be given as a Pathya or supportive treatment as such. Shwasa Atisara, Aruchi Kasa, Murcha Trichala, Shula Jurashofadahan, Tata Avipaka, Swarabheda Sadhan, Daye Dithaswam, Prasamiksha Shastram. So the complications which can occur could be respiratory abnormalities, Atisara, diarrhea, Kasa, and Murcha, unconsciousness, and Shula Jura. That's the signs of hepatic failure, acute hepatic failure. Or the other complications which can occur and which also suggest of asadhya lakshana, anteshu chunam parihina madhyam nanam tata anteshu cha madhyashunam, edema occurring in the body, which can be either in the extremities or it could be in the abdomen, core part of the body. Extremities usually occurs in case of the abnormalities of the circulatory system. Core abdomen are in the ascites, which are both that can occur in case of a chronic hepatic failure, as well as Gudet Shepah Tata Muskashunam Pratamyanam Bisanya Kalpam. Patient who tend to have edema in the genital area, as well as who has impaired consciousness, they have to be considered as asadhya. Vivarjayati Pandukinam Yashorti Tata Asvihara Jarapitam Cha Atisara Jara also is one of the asadhya lakshanas. With this we conclude the chapter. Sashya Samhita Mitra Tantra Prati Kaya Chikitsa Tante Panduroga Pratishedha Nama Shashtodhyaya. Now, if there are any questions, we will try to answer. Right, there are no questions. So wait.